Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, March the 17th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and the General Manager of the Office of Emergency Management.
Well, Brad, thank you and good afternoon. And may I begin by wishing everyone a happy St. Patrick's Day, but with a plea that aside from celebrating at home only with people with whom you live, that people postpone the fun, or much of it, until a date on the 17th of a future month when we will put together some way in which we can mark a day, I know, on which people celebrate great joy, and everybody wants to be Irish. But I think it's best if we keep those celebrations to things that happen within your own home and with people you live with, just in the interests of public health. We will make up for it soon, but that day will come sooner if we don't party today. The City of Toronto continues to work with all of our healthcare partners, pharmacies, and Toronto Public Health to administer every dose of COVID-19 vaccine that we can get from the Government of Canada. To date, 298,992 COVID-19 vaccine doses have been administered to people in Toronto, and that's before we count the vaccinations done today, including at our newly opened clinics. Three of our city-run clinics opened their doors a few hours ago. It was a pleasure to visit the vaccination site with Chief Pegg and Dr. de Villa and Councillor Cressy at the Scarborough Town Centre this morning as it readied to open. This is another big step forward in our Team Toronto effort to get people aged 80 and above to begin with vaccinated as soon as possible. Again, I encourage anyone who was born in 1941 or earlier to book an appointment and please get vaccinated. Our city clinics have the capacity to provide almost 1 million doses a month, subject to vaccine supply from the Government of Canada. That's on top of the clinics that our hospital and healthcare partners are running, 21 clinics today in the City of Toronto, many of which are also vaccinating 80-plus seniors. I want to thank our immunization task force led by Chief Matt Pegg for the work that got us to the point that we're at today with the opening of these clinics. This vaccination work, which began even before a vaccine was approved, is absolutely vital, and it will help us bring an end to this pandemic. And you can see from visiting 2 of the 3 clinics that opened today the amount of work that's been involved in getting those ready. They've been ready actually for some time, but we're opening today because of supply-related considerations. Today, Dr. de Villa will be detailing her ongoing discussions with us here at the City of Toronto and with her colleagues at the Province of Ontario about the current public health measures in Toronto. My role in these discussions has been, as always, to ask many questions about the health situation, but at the same time to draw attention to the other factors which must form part of the overall judgment. First, and in no particular order, the psychology of the people that we serve and are always working to protect. Secondly, the realities of the broader region in which we live. And finally, the state of the economy, last but not least, and the businesses and the people who make it up. Both Toronto and Peel are asking for modifications to the gray zone framework designation. In our daily discussions, Dr. de Villa has outlined 3 points. First, the science is clear. Cases are going up across the province. Cases of the variants of concern are on the rise, and therefore we need to continue to be cautious. Second, based on that science and our commitment to saving lives and protecting health, we cannot let our guard down at the government level or at the individual level. That's why she is recommending some modifications to gray rather than a move to the red zone. While I've always understood the need for a framework with some established parameters, this is a big, diverse province, and this is a very big city, different in many ways than others. So to me, it has always been less about colors at any given point in time and more about what makes the most sense, taking all of the factors I mentioned into account. That's why we are continuing to encourage people to follow the public health advice to wear masks and to keep their distance from others. And that's why we are pushing out vaccines as fast as the supply allows. And the third factor is that we know that to continue to fight the virus, we have to maintain many measures, but we also know that those restrictions must make sense and must reflect reality as we find it. After a long lockdown with warmer weather coming, vaccines being distributed, and regions around us with fewer restrictions, public health officials are recommending some modifications to the gray zone based on all of these considerations led by the data, similar to the change we made, for example, or the province did, for church services just last week. Dr. de Villa will detail these ongoing discussions, but two areas we have been considering include outdoor dining and outdoor fitness and exercise, where we have some past outdoor experience in these areas and keeping people safe. I want to stress these are ongoing discussions. Nothing has been finalized at this point, and changes to the gray zone, of course, would have to be made by the province. No one should start making changes, no one should start making plans or placing orders right now, but we do want people to be aware that these discussions are taking place. Throughout the pandemic, the province has worked with us and listened to our local public health advice, and we hope to continue that cooperation around this very important issue. We are working to move ahead cautiously based on the public health advice while still keeping our guard up and doing everything we can to get people vaccinated. It is encouraging to know that today, a year after the provincial emergency was first declared in response to COVID-19, we are rolling out all the vaccines we have to fight this virus. While we can't gather together again this year, that makes it a happier St. Patrick's Day than might have been the case at this time last year. I would now ask Dr. de Villa to present her remarks for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 576 new cases of COVID-19. 290 people are in hospital, and 50 people are in the ICU. I'm sadly also reporting the deaths of 5 people today. The current number of cases screened positive for variants of concern is 3,920. As you've just heard, we've been in conversation with the province and specifically with the Chief Medical Officer of Health about where next to take Toronto within the provincial COVID-19 framework. At this time, it is my view the data do not support the kind of reopening that would be provided for under the red zone designation. We anticipate that the province will announce its decision formally on Friday. In our conversations, we've indicated an openness to a modest expansion of the options available to people in Toronto, particularly outdoor-focused activity. I have always said that in my duties as Medical Officer of Health, I would be guided, like all public health practitioners, by the responsibility to champion public health and by data that paint a clear picture about the right course of action. Facts and data have always formed the basis for my advice and perspective. Facts and data have led us along a very difficult but necessary course of action, and facts and data have led to support for change or reversing course. We are moving into a new season and warmer weather, and we have evidence that outdoor activity is lower risk than indoor activity. Everyone sees the exhaustion within the city as it relates to all the limitations COVID-19 has forced upon us. This is understandable and inevitable. This is why modest steps forward in the realm of outdoor activity are a good proving ground at this time. If in the window of the next few weeks, the data indicate course corrections are necessary, then course corrections can be made. I certainly take the view that in the variant environment, that course correction must be swift and decisive should the outbreak's pace of expansion sound alarm bells. I will not hesitate to call for actions in this instance. In public health, all or nothing is seldom a workable solution. Certainly, at the height of the pandemic, at its most dangerous, there was widespread support for very strong restrictions to bring under control the threat to ourselves and to our healthcare system. Today, our long-term care and retirement home populations are better protected than at any other point in the pandemic. Steady progress is being made to vaccinate people 80 years and older and healthcare workers. And vaccine supplies will continue to increase. And we know that as spring arrives, people will be able to spend more time outdoors. What I've described for you today represents change that can be tried given our current circumstances. But these are incremental changes, and they are cautious and can be reversed if circumstances demand. So I'd like to restate a few key points. We all need to fully understand what might happen at any point as we move ahead in the next stretch of time. First and foremost, the pandemic continues. Variant infections have risen steadily, if slowly. Even small steps forward, permitting additional outdoor activities, do not signal that the threat has been reduced to an extent that we can let our guard down when it comes to self-protection. In fact, each step forward is a reminder that we've got to up our game. We are increasingly moving around, and we have to do it masked and at a distance, and with every other practical consideration we can make to prevent the spread of COVID-19 and lower the risk of becoming infected with it. The more we can reduce the spread of COVID-19 through distance and masking, the more effective our vaccination efforts will be. Finally, today, a quick plea again to support getting 80-year-olds vaccinated. Parents, grandparents, aunts, uncles, friends, neighbors, whomever you know that's 80 and over, please reach out to them. Ask them about their plans to be vaccinated and offer to help them, whether it's to book an appointment, whether it's to get to a clinic, or whether it's to arrange a call to their own doctor to talk about getting vaccinated. We know that people trust their own doctors, and we know that a problem shared is a problem halved, and many times a problem solved. Please think about the 80-year-olds in your life who've come through this past year and help them make their years ahead safer. As ever, for all of us, what happens in the future relies in large part on what we do, how diligent we are about mask wearing and distance, and how respectful we are of COVID-19's continuing capacity to resurge if we're not careful in our actions and our choices. I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa. Good afternoon. At 11 o'clock this morning, we successfully commenced operations in the first 3 of the city-operated COVID-19 mass immunization clinics. At present, residents 80 years of age and older are receiving their first dose of Pfizer vaccine inside the Metro Toronto Convention Centre, Scarborough Town Centre, and the Toronto Congress Centre. 1,350 people have appointments to be vaccinated in our city-operated clinics today. Appointments in all 3 of these clinics are fully booked from today through Sunday. As of my last update, there were still appointments available on Monday next week and each day thereafter. Appointments are continuing to book up steadily. As of 10 o'clock this morning, more than 21,000 people have successfully booked their vaccination appointments in city-operated mass immunization clinics. Beginning today and through Sunday, March 21st, a total of 1,350 people are able to be vaccinated in our city-operated clinics each day. On March 22nd, our capacity jumps to 4,320 vaccinations per day. On March 29th, our capacity jumps again to 6,300 vaccinations per day in our city-operated clinics, with both Malvern Community Centre and Mitchell Field coming online. On April 5th, our capacity once again increases to 8,100 vaccinations per day in our city-operated clinics, with clinic operations inside the hangar in Downsview Park coming online. And finally, after April 12th, our planned capacity will increase to more than 18,000 doses per day, with our final 3 city-operated mass immunization clinics at North Toronto Memorial Community Centre, Carmine Stefano Community Centre, and Cloverdale Mall all coming online. This, of course, is all dependent on the continued availability of vaccine. Just a few moments ago, I spoke with the clinic managers who are on site in each of our 3 clinics. Clinic operations are running smoothly, and the pace of operations is consistent and appropriate with the needs of those being vaccinated. We have mobility assistance devices on site, along with trained healthcare professionals and emergency first responders on site, who are helping anyone who requires assistance in moving through the clinic. Each of the city-operated mass immunization clinics will operate between 11 a.m. and 8 p.m. 7 days per week. I remind everyone that vaccinations are only available by appointment and are not available on a walk-in basis. I strongly encourage everyone who was born in 1941 or earlier to make your appointment for vaccination now. If you have an Ontario Photo Health Card, you can book using the online registration system, which can be accessed 24 hours per day at covid19.ontariohealth.ca. If you prefer to book by phone, the provincial call centre can be accessed by calling 1-888-999-6488. The provincial call centre is available from 8 a.m. through 8 p.m. 7 days per week. Please do not contact 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the COVAX system on your behalf. At present, only those who were born in 1941 or earlier are able to book appointments in city-operated mass immunization clinics. In order to avoid placing unnecessary loading on the booking system, we ask those who do not meet those eligibility criteria to avoid trying to access the online booking system until such time as you are eligible for vaccine. This will help to ensure an efficient and effective booking process for everyone as we move forward. If you choose not to book an appointment now, or if you are unable to book your appointment for any reason, rest assured your opportunity to book your appointment will continue. Once you are eligible for vaccination under the Provincial Vaccine Priority Framework, you remain eligible to book your appointment moving forward. Please help us maintain effective clinic loading by not coming to a clinic until you have a confirmed appointment. And please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you.
Thank you, Chief Pegg. We'll go first to Matt Bingley from Global News, and just a reminder to please unmute yourselves before you ask your question. Go ahead, Matt.
Hi, good afternoon. Chief Pegg, just outside the the Scarborough Town Centre this morning, it was quick to sort of notice there were some issues there, lineups without any physical distancing outside, some people pointing out that they had difficulty finding their way to the location because of a lack of signage. And just down at the MTCC, there is a rather large ramp that people have to get up, and someone with mobility issues might have some issues there. I realize it is the first day, but I'm just wondering how quickly you'll be working to address some of these issues as they do come up.
Sure, and well said, Matt. It is the first day. So let me answer those in sequence. So with respect to Scarborough Town Centre, we did become aware, we received some feedback this morning with respect to suggesting some additional outdoor signage that just directs people to primarily the parking location inside or in the Scarborough Town Centre in order to access the clinic. So we're working on that already, and those things are underway. The loading issues that some observed initially at Scarborough Town Centre were immediately At the point, right at 11 o'clock before the doors into the clinic had opened, it was very quickly resolved as people moved into the process and, of course, into the appropriate physical distancing. That's a lesson that we're learning as we go, and our clinic managers are all aware of that, and we're going to pay additional attention and some additional consideration to that tomorrow and moving forward. With respect to the concerns that were raised, or you spoke about at Metro Toronto Convention Centre about the elevators, that did come to our attention today. We've had people look at that. The provisions are all in place. We do understand, again, that there may be an opportunity for a little bit more clarity or some additional signage, and our team is already working on that as well.
Thank you for that. To Dr. de Villa, I'm just wondering, when you talk about some of those, you mentioned outdoor dining and outdoor fitness. I'm just wondering what else you're possibly looking at, because as people will be quick to point out, you could get a haircut outside. How far-reaching do you want these measures to be sort of relaxed?
So Matt, at this point in time, we've certainly had discussions around such things as outdoor dining and outdoor fitness, primarily because we've had experience with those, and we have some data and facts to back those discussions. But certainly, I don't preclude discussions on any of the items that might be outdoors, because we know for a fact that activities that are undertaken outdoors are clearly much lower risk than those that are indoors. And of course, the risk does start to drop even more as more and more of us are able to undertake vaccination now with the opening of the mass immunization clinics and the increased supply that seems to be coming.
Matt, let me just add, just on the Front Street at the MTCC, there is an accessible entrance by the second cup. So anybody requiring assistance can access the clinic that way. They'll be screened at the door, then can take the elevators up, and paramedics will be able to assist and escort. And more signage, as Chief Pegg indicated, is coming. Thank you for that. We'll go next to Lauren Pelley from the CBC.
This is just another follow-up question as well on staying in the gray zone. So, what is the message for a lot of business owners who have been saying that this lockdown has gone on far longer than they expected already? Obviously, it's been a huge financial and emotional strain, but some are also feeling that the original purpose to flatten the curve and to make sure the healthcare system wasn't overwhelmed, is something that's sort of in the past now. What is your take on that? Can you just shed a bit more light on the third wave that we may be experiencing, and why these measures are still needed at this point in time, a year after Toronto first went into a form of lockdown?
Yeah, so Lauren, those are excellent points that you raise, and I appreciate and understand the many challenges, that residents and businesses throughout the city have had to deal with over the course of the past year. There's no question there have been choices that needed to be made. There were necessary actions that needed to be taken, particularly at the height of case activity at various times here over the course of the last year. I would say this, when I look at our numbers, unfortunately, I wish I could tell you that the pressure was completely off our healthcare system and that we were free and clear and that we needn't worry any further. Unfortunately, that's not the case. We are still seeing, a number of hospitalizations, and the data most recently is showing an increase in hospitalizations as of late. So there are still a number of pressures on our healthcare system, and unfortunately, people who are becoming seriously ill with COVID-19, and unfortunately, lives that continue to be lost associated with COVID-19 infection. So all the more reason to continue vigilance. We know that in this environment where we're seeing an increase in the variants of concern, and we know that these variants of concern are more transmissible and associated with more serious illness, that we do know that that's part of our picture, but we know that distance and masking and the measures for self-protection work. So where we go from here, how our healthcare system fares, is in our hands. We actually have the power to change the course, particularly as vaccines come on board and as more and more of us are able to take our turn to get vaccine.
One further question just for one of my colleagues. When it comes to the distribution of vaccines to the public health units, do you think that it would make more sense for those to be sent to places that need them most? So taking York Region as an example, if they are so far ahead with their rollout that they're starting to vaccinate professions like naturopaths, would you like to see the province sending more vaccines to Toronto instead, where we have more high-risk people in their 80-plus range waiting to get their shot still?
So with respect to how best to distribute vaccine and what the evidence and science shows on this, we know that, one of the most effective methods by which to distribute vaccine, particularly if there are supply issues, are to direct those vaccines towards those who suffer the most serious outcomes and the most negative outcomes with COVID-19 infection. And those are older people within our communities. I think there's also pretty good evidence out there that suggests that one of the best ways to manage the circumstances is to provide COVID-19 vaccine preferentially to those areas that actually have activity, so as to control the risk and to mitigate the risk in those surrounding areas that perhaps don't have as much COVID-19 activity. So hence there is a prioritization framework that's meant to address some of those issues, but certainly I think we're all learning every single day as we go through with this, the largest vaccination campaign in the history of this province.
Thank you. We'll go next to Dave Woodard from Global News Radio. Dave, go ahead.
Thanks, Brad. So a modified gray zone, let me get this right. It means that for indoor hair, nail salons, indoor gyms, and indoor dining spaces, they'll still remain closed. Does that worry you that people could start to flock to the underground economy for these services?
I think when it comes to what exactly will happen here, that's ultimately a decision for our provincial counterparts, and there has yet to be a decision formally made. As the Mayor indicated, and as I indicated in my remarks, we are continuing to have conversations with our provincial counterparts, as we always do, particularly as we get to decision-making points over time. But I would say this, that when I think about what we can do together and what we have done thus far, we know what makes a difference in respect of trying to reduce COVID-19 activity and how we can actually move us closer and closer to life more like it was before COVID-19 in as safe a way as possible. And for now, what that means is still maintaining our distance as much as possible. Not doing activities, not interacting with others unless it's absolutely necessary. And when you have to get, close to others with whom you don't live, to wear a mask as much as possible in order to prevent the spread of COVID-19. That, combined with vaccines and taking up vaccine as your turn comes up, is really it's the combination of these things that will get us to the other side of this pandemic and more to a life like we all want to enjoy.
Hey, you didn't really answer my question about the underground economy, but maybe one of my colleagues will ask. Dr. de Villa, I do want to ask you, I know it's not your portfolio, but we've heard from geriatricians and seniors advocates who say that restrictions should be loosened for long-term care homes now that most people living in those residences have been vaccinated. What are your thoughts on that?
Well, my thinking is that obviously you do need to think of the health of the entire person, and I'm certainly pleased to see that COVID-19 risk has dropped dramatically and activity has certainly dropped dramatically in long-term cares and retirement homes. I think that there are a number of conversations that are happening, certainly at the provincial level, but I can appreciate and understand an interest in moving towards loosening restrictions in order to take into better consideration, the overall health of individuals who reside in those facilities, particularly as they are increasingly protected through vaccination efforts.
All right, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you. Dr. de Villa, we know research to detect COVID levels in the city's wastewater has been going on for at least 6 months now, and testing has expanded over that time. That information is being made available to you to possibly detect the virus in the community quicker to help you with your decision-making. How is Toronto Public Health using that data exactly, and if not, why?
So Mark, you're right, we do get those data, and we use those data to help inform our decision-making as we move forward over the course of the pandemic. It is research data. It does belong to our research partners. And at this point in time, given that it is research data, it is used to substantiate our primary data, things like case counts and case rates, the reproductive number, percent positivity when it comes to tests. So we take all of these data, all together to help inform our decisions and our actions as we respond to the pandemic.
That's information collected in Ottawa, for example, is posted online. Why isn't the research being shared with TPH being made public here?
So I can't speak to Ottawa's circumstances, but I can tell you that when it comes to our data, it does belong to the research institutions, and therefore it really is for them to post.
Okay, thanks. We'll go next to Jeff Gray from the Globe and Mail. Jeff?
Hi, everybody. Thanks, Brad. I just wanted to ask just for a little more specifics on what it is that is under discussion with Dr. Williams. Outdoor patios for restaurants, I understand that. Outdoor fitness, which sounds like gym classes for adults. Is there any discussion of kids sports?
So at this point, our conversations did not specifically focus on kids sports at this point in time. We did speak about outdoor fitness, which may, again, be something that children might be engaged in, fitness activities, at least some of the older children. But we're certainly willing to discuss, various options with our provincial counterparts in keeping with facts, data, and trying to mitigate and manage risk as best as possible given our current circumstances.
Thanks. Okay, and just to follow up, is there any indication from Dr. Williams or the province what their thoughts are? I mean, there's no discussion of them wanting to further open things up in Toronto or move Toronto into the red zone. Is there?
There hasn't been a specific discussion or really clear statements made around this must be open or that must be open. I think it's been quite a collaborative discussion around what makes sense given the unique circumstances here in Toronto. We are a big city, a dense city, very urbanized environment, and our circumstances are quite different relative to what many other communities around the province are experiencing. So, I'm grateful for the fact that our provincial counterparts recognize that, and they are quite collaborative and open to discussing what opportunities exist for us here, given our unique circumstances.
Thank you very much. We'll go next to Nick Poivert from CBC News. Nick?
Hi, thanks. And for Dr. de Villa again, sorry, we're keeping you pretty busy today. I'm just wondering if I could get your thoughts on the Premier seemed to indicate yesterday that he would be supportive, it sounded like, of maybe moving to people in their late 70s ahead of some of the healthcare workers that they're now getting to, say, in York Region. Would you be supportive of a change like that? And do you think Toronto should maybe have a bit more independence and ability to make those decisions on your own?
I would suggest to you that, look, there is a provincial prioritization framework that has been well articulated and communicated to the public. At this point in time, we are vaccinating in accordance with that framework, given the supply issue. But I would tell you this, and I think, we have a bit of a running joke here around who gets to speak for whom around here. So in this instance, I'm going to speak for Chief Pegg, if I can take that liberty for a brief moment, and say that he would like nothing more. In fact, all of us would like nothing more than to be able to have, endless quantities of vaccine so that we can vaccinate as many people as possible. Healthcare workers, those above 70 and those lower than 70. We really just want to get vaccines into as many arms as possible, as quickly as possible, given that we know how effective they are in terms of preventing the most serious outcomes associated with COVID-19 infection.
and this one could maybe go to you, Dr. de Villa or Chief Pegg. Are there many people getting vaccinated in the city who aren't residents of Toronto? Does that account for a significant number of the vaccines that have been administered, or those people maybe working in the city but who don't live in the city?
So I don't have the exact number on those at this point in time. I do know that there are a number of people who would have been vaccinated here at Toronto clinics who may not reside in the city, but who work here. So for example, we have a number of healthcare workers who serve the Toronto community and serve at Toronto agencies and facilities, but don't actually live here. In long-term care, in acute care, in all the many aspects of our health sector. And they would have been eligible for those that were in part of that phase 1 prioritization framework. They would have been eligible to receive vaccine at Toronto clinics, and rightfully so. Again, the more we can protect people who are in and about our community, those who live here, and yes, those who work here, I think that's a good thing towards protecting our city and our entire community from COVID-19.
Chief Pegg?
Nick, the only thing I will add is important to note that when the provincial booking system came online on Monday, in accordance with the provincial framework that booking system is built around, it is not geographically fenced or geographically limited, so to speak. So it is really a province-wide system that makes availability to, or extends availability based on the prioritization framework to Ontario residents, and gives those residents, gives all of us the opportunity, once we're eligible, to log in, to see the clinics closest to us, but to choose from available, whatever your choice of available appointment in the clinic of your choice. So that is a change on Monday. That will be the process moving forward, and we'll continue to administer vaccines in accordance with the scheduled appointments that, of course, have been made pursuant to the provincial framework.
Thank you. We'll go next to Jennifer Pagliaro from the Toronto Star. Jen, go ahead.
Hi, everyone. If Brad will permit me, I just have a clarification I want to ask Dr. de Villa, and then I do have two actual questions.
All right.
But I just want to try to understand, because earlier in the statements, Mayor Tory said that you had recommendations, Dr. de Villa, but what I'm hearing from the answers and what I'm trying to figure out what I should tell our readers is that you might be recommending certain things to Dr. Williams that may or may not be approved by the province. It would be inaccurate for us to say you are currently recommending outdoor dining. Is that fair?
So Jennifer, what I have discussed with the province is, that I think it's reasonable to move forward with modest expansions to what's permitted, in terms of activities, particularly outdoor-focused activities. We've got warmer weather coming. We know that, people will spend more time outdoors in the warmer weather, and on the plus side, outdoor activities are just lower risk in terms of COVID-19 transmission. So certainly we've had experience with outdoor dining and outdoor fitness. Those are the kinds of things that we have very specifically discussed and that I can, see as reasonable, modest expansions of the kinds of activities that would be allowed, given our current circumstances and given what we understand of COVID-19 transmission.
And Brad, just to speak to the language that is used, Dr. de Villa will detail these ongoing discussions, but the two areas we have been considering include outdoor dining, outdoor fitness, and exercise. That's what I said.
Okay, question number one, Jennifer, go ahead.
Yeah, thanks. I'm not sure if this is for Carlton or if there's another staff person online, maybe Barbara. I'm just wondering, I know Cafe TO registration started early this year. I'm wondering if, in fact, outdoors dining is permitted by the province, maybe as soon as next week. We're supposed to have a pretty nice, mild weekend. How quickly the city is able to get those patios up and running for restaurants that have already applied.
We'll start with Barbara Gray.
Oh, thanks, Brad. Hi, Jennifer. We are on track to get patios up and running in early May. People who have existing permits for outdoor dining can certainly open up as soon as it's deemed safe to do so by public health. So with regard to the Cafe TO program, we still have a little bit more to do, and we also have to get through our spring clean program. So we're geared up to launch as quickly as we can in early May.
Can I just add?
Yes, of course.
I think we've explained before, because we'd love to have these going as soon as possible, but and I think we've learned from painful experience during my time as mayor and before, that we can have snowstorms up to and including late April. I think we had one quite recently in late April. And so that has to be taken into account. And then, as Barbara just said, the roads, the catch basins and so on have to be cleaned. And so we've asked, in many discussions with Barbara and her team who are doing this as quickly as possible, how early can that work all be done such that we wouldn't have catch basins that then would be jammed up during the rainstorms in the summer? And the answer that came back was early May, so that these could be open by the May 24th weekend. So as much as we might want to have them open in April, it's not practical, both from the standpoint of remaining risk of snow that has to be cleared and the cleaning up that has to be done in the spring to make sure that we don't have flooding in the summer.
Okay, thanks. And then just quickly, I wanted to ask Dr. de Villa just about the situation with school closures in York. Just wondering how quickly you're monitoring that, if you have concerns, just given the case counts and variants here, how that, if you see that playing out in Toronto in any similar way.
So we do have a significant number of the team at Toronto Public Health who is following schools. There were investments made by our provincial counterparts that allowed us to staff up appropriately, and they are an incredibly busy team. I don't have specific details at this point in time. I do touch base with the team pretty regularly, and they certainly do bring to my attention any issues or concerns that they have. They do note that there are cases out in the community, in schools, and these are most often related to cases that exist in the community. So the more activity there is of COVID-19 in the community, the more we see within our schools. That's just something that we have observed over the course of the past several months. So that's why we constantly speak about the need to continue that vigilance for self-protection. I think the other thing that I would note is that it was interesting. There was an anecdote that was shared with me by our schools team as they looked into cases, including those that are variants of concern. And in a number of circumstances, they have found that when they discover cases within the school and they are able to test the entire cohort, they have found that when infection prevention and control measures are actually well practiced and well used, that they are quite effective in terms of preventing transmission within the school setting. That's been found on at least a few occasions that I can think of, a top of mind, having had conversation with our team about what they're seeing as they investigate specific cases within schools.
Thank you. Our final question is to Holly Mackenzie-Sutter from the Canadian Press. Holly, go ahead.
Hi, just looking for a comment from Dr. de Villa and Chief Pegg about the science table report on bringing vaccines directly to buildings with a high number of seniors. I'm just wondering if that's being considered, and I guess your response to those findings.
So I've not actually had the opportunity to take a look at the report myself, but I would suggest this, that we have the health sector vaccine leadership table here at Toronto. We're represented there as Toronto Public Health, as are a number of health system partners who are participating in our vaccination efforts. They are actively exploring. There are a number of subtables as well, groups that are meeting on things like logistics and distribution, community engagement, communications, coordinating our efforts across the city. This is, of course, the largest vaccination campaign that's ever been undertaken. So you can well imagine that there are a number of moving parts. So they are actively exploring all the different routes by which we can make vaccine available as efficiently and effectively as possible, and certainly looking at opportunities to provide pop-up or mobile clinics to those buildings that have a high proportion of seniors is on the agenda. And, I expect we'll hear more and more about that as efforts ramp up and as we continue our vaccination efforts.
Do you have a follow-up, Holly? You just need to unmute. There you go.
Yep. I wanted to ask just more broadly too about just the idea that mass vaccination sites aren't really a feasible option for a lot of people over 80, no matter where they live. So can you go into a bit more detail about other kind of accessibility options, like whether mobile units or giving people transportation or going door to door, if that's being looked at to make sure we don't miss this group that can't go to the bigger sites?
So why don't I start, and I'll see if the chief has anything further he would like to add. First and foremost, when it comes to our mass immunization clinic settings, there are a number of measures that are being put into place to try to make them as accessible as possible for those who are able to attend. And as you heard me mention in my remarks, you know, I'm encouraging people as much as possible to help out those who are, you know, 80 years of age and older that they know of in their lives. Help them to get access to the vaccine, whether it comes to, you know, booking the appointment or getting to the appointment. You know, I think these are things that we can all do for each other to support, you know, those in our community who would have challenges otherwise getting vaccinated. It's a good way to protect them and a good way to protect all those around them as well. As I mentioned, that health sector vaccine leadership table does have a number of different partners around the table, and some of them have already gone and done a number of these mobile vaccination efforts, particularly for what we call congregate settings for seniors. So certainly that is happening already, and I expect that as the partners continue their work with each other, they will continue to find new and different ways to make sure that we're serving people for whom mobility is a challenge as best we can. There are you know, different agencies that have different networks and different ways in which they interact with their clients. We're relying on our partners to use their networks and to use their resources and their strengths to best serve the community altogether.
Perhaps just what I can add would be just to reiterate that the locations of all of the city-operated clinic locations, all 9 of them, we have done our very best to pay particular attention to select sites that are as readily accessible to all as possible, and that includes via public transit. I appreciate that nothing may ever be perfect in the sense of any particular location, but we've really done our best to select sites that are geographically distributed across the city that are readily accessible. Very proud of the fact that all of our sites are fully accessible, and in addition to simply being accessible by their design and nature, we are ensuring that there are mobility assistive devices on site, and we have trained healthcare professionals and trained emergency first responders in every clinic who are more than willing and who in fact are there to ensure that we're able to support these folks that are coming to the clinic. Our experience to date is that the majority of folks are arriving with support or with a caregiver. Those that are not, we have staff there that will assist in getting in and moving through the clinic process in a safe and orderly manner and making sure that all of their needs are met. So that's been a priority of ours from the start. Only other comment I can make about mobile operations, we have included the notion of mobile clinic operations in our vaccination plans from the outset, from the very start. As Dr. de Villa indicated accurately, the decision about the prioritization of those needs and the deployment of those resources falls to the vaccine leadership table. They assess that from a clinical perspective and a medical directive perspective, and we mobilize and will continue to mobilize on a go-forward basis to the best of our ability. The challenge with mobile operations with respect to delivering COVID-19 vaccines is some of the vaccine is difficult, it's difficult to move. And it just becomes a much more significant logistic challenge to do some of the issues or manage some of the factors in mobile deployment that aren't as prevalent an issue in a clinic location. So we have all of those on the table. We'll continue to mobilize all of those options to the very best of our ability. And of course, as we move forward and further to the recommendations and guidance that come from the vaccine leadership table, we'll respond accordingly, and if that means we need to adjust our plans, we'll adjust our plans.
right, thank you very much. That concludes today's briefing. Our next scheduled briefing will be next Monday, March the 22nd. Please stay well.